In fibromyalgia, the kind of core issue is something called central sensitization. So it's basically your body's nervous system kind of stuck at the highest volume. And so it's very challenging for patients to undertake any kind of traditional rehabilitation because their nervous systems are so sensitive. So basically, the body finds even just regular movement to be very threatening and then can trigger pain responses very easily. And so within our program, we can utilize various autonomic and nervous system regulation strategies, including breathing exercises, very gentle and paced movements, especially movements on the floor, strategies to stimulate the vagus nerve to help switch from that fight or flight state into kind of a more calming nervous system state that doesn't find non-threatening stimuli to be threatening. I think it's very important when we're creating exercise programs for fibromyalgia patients that we are very incremental in progressing, and we are very mindful of movements and positions that do trigger pain. So it's about finding the strategies that are non-threatening for the individual's body and nervous system, and then building a foundation and building up from there. Sleep and the nervous system are intricately linked, and it's very difficult to have quality sleep when your nervous system is stuck in fight or flight. Addressing sleep with fibromyalgia patients, as well as any other post-infection chronic condition patients, in order to improve sleep, we need to improve regulation within the nervous system. So nervous system regulation strategies, safe movement, energy management, and conservation strategies throughout the day can kind of help with that improved sleep quality. What I would say to a patient that feels like they've tried everything and they're not getting better, you just haven't necessarily found the roadmap or been given the roadmap to understanding what's going on in your body and what you potentially could do to help improve your symptoms and your quality of life and your function. If you think that you might have a post-infection condition, would be to reach out and book an initial assessment with one of our physiotherapists. In that initial appointment, which is 60 minutes long, we'll go through a full clinical history, past medical history, and look at sort of what your day-to-day symptoms look like, what your day-to-day function looks like.